So what is happening? Why are these receivers not working? And this is where it's a little bit muddled. We have some clues, but we don't have a perfect picture. We know that genetics is one of the big reasons that the receivers malfunction, but it's not uncommon for someone to develop diabetes with no family history. And just because someone in your family does have diabetes does not guarantee that someone else is going to develop it. It just increases the likelihood. There's also some natural insulin resistance that happens with age, so receivers just naturally break down. And this is especially true after the age of 70. We do know that physical activity, so using and developing muscle, increases the number of receivers and improves the quality of the receivers. So being active, whether with strength training or walking or running or dancing, any of those activities all help improve the receivers within the cell. We know that tobacco and alcohol are more likely to make the receivers malfunction. And the more that people tend to use these things, the more likely that the receivers malfunction. We also know that eating a lot of saturated fat is more likely to make the receivers malfunction. Again, none of these are guarantees. It doesn't mean that if you do this thing, you will develop diabetes. We just know that these are all little hints and clues that might make the receivers malfunction. We also know that stress, whether it's physical stress or emotional stress, right, not getting enough sleep, dealing with COVID, dealing with work issues, immigration issues, politics, you name it, that chronic stress changes hormones in the body that also cause the receivers to malfunction. And something that's really interesting too is that starvation can temporarily cause receivers to malfunction, especially if someone begins to eat again. So it happens for people who, for example, have cancer and have lost a lot of weight and then are trying to bring some of that, eat again. It happens in eating disorders. It's also been known to happen, in areas of famine or starvation. That there's a natural insulin resistance that develops as a byproduct of starvation. So in the next videos, we'll talk about the numbers, like what they mean. What does an A1C mean? What does it mean when you prick your finger? And we'll also talk about ways that people can make sustained shifts in lifestyle to try to reduce risk and improve outcomes in diabetes. So stay tuned.